Look, we've all been there, right? You sprain your ankle, you take a nasty fall. Pain is part of the deal. But what happens when the pain is way worse than it should be? What if the pain itself is the real emergency? That's exactly what we're digging into today.
So let's just imagine this for a second. You fracture your leg. Ouch, right? Of course it's going to hurt. But then something changes. The pain just keeps getting worse. It becomes this deep, throbbing, relentless agony that is just completely off the charts for a broken bone. This right here isn't just bad pain. This is a 5-alarm fire bell telling you something is seriously wrong. All right, so let's jump right into the number one most important clue. And here's the thing. You can't see this on an x-ray. It won't show up on a scan. This is a warning sign that only you, the person feeling it, can report. And this is really the key to everything. We are talking about pain that is just wildly out of proportion to what happened. It's that gut feeling, that voice in your head screaming, wait a minute, this is not right. This is so much worse than it should be. That feeling, that's your body's most important alarm system, and you absolutely have to listen to it. So, what in the world is going on inside your body to cause this just awful pain? Well, it's a condition called compartment syndrome. And honestly, the best way to think about it is like a pressure cooker, but it's happening inside your own limb. Okay, let's break this down. Your muscles aren't just floating around in there. They're neatly bundled into these, well, compartments. And these compartments are wrapped in a really tough, almost plastic-like tissue called fascia. So when you get a bad injury, you get swelling. But because that space is totally enclosed, the pressure just builds and builds and builds. It skyrockets. And that's where the real danger starts, because it literally starts to squeeze the blood vessels shut. To really get a picture of this, let's use a simple analogy. Just picture your muscle compartment as a car tire. Now, the swelling from the injury, that's like hooking up an air compressor and just letting it rip, pumping way, way too much air inside. You can just feel that pressure building, right? So why doesn't it just expand? Well, that tough rubber of the tire, that's your fascia. And here's the big problem. It has almost zero stretch to it. None. So as all that fluid and swelling pours in, the pressure has absolutely nowhere to escape. It just builds and starts to crush everything inside, the muscle, the nerves, and most critically, the blood vessels that keep everything alive. Now look, this isn't something you're going to get from a simple rolled ankle. We're talking about major, severe trauma here. A really bad fracture is the classic cause, but you can also see it with serious crush injuries, or even, and this is wild, some types of venomous snake bites can trigger this whole dangerous process. Okay, so besides that crazy, off-the-charts pain, what other clues should you be looking for? Well, doctors and medics have this really handy checklist they use. It's called the 6 Ps. And here they are. You can think of this as your critical checklist. First, we've got pain, the big one we already talked about. Then pallor, which just means the skin looks really pale, kind of pasty. Pulselessness, which is a very, very bad sign. Paresthesia, that pins and needles tingly feeling. Paralysis, where you literally can't move the limb. And the last one, poikilothermia. It's a mouthful, but it just means the limb feels really cold compared to the rest of your body. Let's go back to that first P for a second, the pain, because it's so, so important to get this right. The difference is just night and day. Normal pain kind of matches the injury, right? And it might ease up if you rest. But this is a whole other beast. And here's a huge, huge clue for the doctors. It gets way, way worse with passive stretching. What does that mean? It means if someone else, like a medic, gently tries to wiggle your toes for you, and it sends a lightning bolt of pain up your leg, that is a giant red flag. So, what about some of those other Ps? Well, pallor, the paleness, and poikilothermia, the coldness, those are direct results of that pressure cooker we talked about. It makes perfect sense, right? If the skin looks pale and feels cold, it's because the pressure is literally strangling the arteries. It's blocking the warm, oxygen-rich blood from getting where it needs to go. And then you have paresthesia and paralysis. Those are huge warning signs that the nerves are in deep trouble. That numbness, or when you find you just can't move your fingers or toes anymore, that means the nerve cells themselves are suffocating, they're being starved of oxygen. And let me be clear, these are late signs. If you're experiencing these, it means permanent damage is setting in. This is bad, really bad. So let's be crystal clear about this. Spotting these signs is step one. But you have to understand, compartment syndrome is a true lights and sirens surgical emergency. We are talking about a situation where every single minute matters. So what do you do? What's the plan? Number one, recognize those signs. Go through that 6 P's checklist in your head and pay special attention to that out-of-control pain. Number two, get to a hospital immediately. This is not a wait-and-see situation. And number three, understand that this is not going to fix itself. You can't just ice it or elevate it. This needs surgery to relieve that pressure. The surgery is called a fasciotomy, and the idea behind it is actually pretty straightforward. A surgeon makes a long cut to slice open that super tight fascia, and boom, it immediately lets out all that dangerous pressure. It's literally like taking a knife to that overinflated tire. The relief is instant, and it lets blood rush back into the tissues, saving them from dying off. All right, we've covered a ton of ground here. What causes it, what to look for, how it's treated. But if you walk away from this with only one single piece of information burned into your brain, please let it be this. This really is the whole ball game. Yeah, the other P's are important, but they can show up later. This one, the pain that just feels wrong, the pain that is so much bigger than the injury, that is your first and most trustworthy warning sign. You have to trust that feeling. And that really brings us to the final takeaway here. Look, modern medicine is amazing, no question. But sometimes the most powerful tool we have is our own gut instinct. When your body is sending you a signal that clear, that loud, when it's screaming that something is fundamentally wrong, the absolute most important thing you can do is listen to it.